Chatman. I'm a senior kinesiology major with an emphasis in pre-physical therapy. And as you've heard, I'm going to be talking about how public knowledge of physical therapy impacts direct access, specifically in Texas. So, what is physical therapy? A lot of people assume they know what physical therapy is, and while that might be true, there still remain a lot of misconceptions about the field, and so I'll talk about some of those. So, physical therapy is a multifaceted healthcare profession that really focuses on lessening pain, improving function, and just improving the overall quality of life of the patient. And typically this happens through treating musculoskeletal conditions. Physical therapy is also promoting patient education. When people come in, maybe they work labor-intensive jobs that are hard on their bodies, they might want some information about how to prevent injuries in the future. As well as when you are discharging a patient, oftentimes you might be interested in making sure they don't come back to the physical therapy clinic. So you're going to give them the education about their bodies, about what not to do, and what to do to make sure they maintain their health. So physical therapy is also helping patients help themselves. They have to do all of the work. Physical therapists can just tell them what to do and the way that they should do it, but you have to put your trust in them that they'll go home and they'll actually do that. And so helping people understand their bodies really, really goes a long way with physical therapy. So physical therapy is not a way to get a massage. While manual therapy and muscle manipulation is definitely a big part of physical therapy, and it does overlap with massage therapy, they are not the same thing, and they shouldn't be considered the same. So don't go to your physical therapist and expect you to get a massage for an hour. Physical therapy is also not only for those that are in pain. You can have injuries without being in pain. You can also have conditions that the symptoms need to be managed by a physical therapist without pain. Physical therapy is also not for those that are recovering from an injury. In fact, there is an entire field of physical therapy called pelvic floor therapy that helps people pre-pregnancy, during pregnancy, and after pregnancy, and that is not an injury, but they still need those services. So what is direct access? Well, direct access is exactly what it sounds like. It's the ability for patients to access physical therapy services without the need of a referral from a physician. Currently, the United States has 50. All 50 states have something called direct access. It can range from unrestricted to restricted. There are places like Colorado that are completely unrestricted. So a patient can come in and receive services for as long as the patient and the therapist deem necessary. And then you have states like Texas that have restrictions on direct access, whether there are conditions to when you can receive it or for how long you can receive it. So what are the laws in Texas? Well, there are two instances that you might run into. One would be if you have a physical therapist that has a residency. A residency in physical therapy is just an additional year of training in any topic that they wish to expand their knowledge on. So geriatrics, pediatrics, oncology, sports, it could be anything like that. After working for 1 year, they can then treat a patient without a referral for 15 consecutive calendar days. Now, the second instance would be a physical therapist without residency, and this is what you are going to encounter most often. Most physical therapists do not have residency, and so after a year of treating, they can see a patient for 10 consecutive calendar days. Keep in mind, I say calendar days, this does not mean appointments. So this means if you come in for an evaluation on a Monday, you have until Thursday to get a referral from a physician before you can continue physical therapy. So what does the research say about direct access? So far, research has found direct access to be a safe, effective, and an economical way to practice physical therapy and also be a healthcare provider. It's also been found to increase relationships with healthcare providers in general and remove barriers. There are a lot of people that might not be comfortable with doctors, or they might not have a primary care physician, and so direct access is a way that you can bypass that without something I push. So there are barriers to direct access. There's a reason why there are some states that are restricted and some are unrestricted. So some barriers to direct access would be usually coming from other healthcare professionals like chiropractors or other physicians. There's a belief that physical therapists cannot recognize red flag symptoms. A red flag symptom is basically a symptom that is associated with a condition that a physical therapist cannot treat. So that could be symptoms of cancer, symptoms of neurological disorders, or or just other conditions that you have to refer out for. And then also there's a belief that PTs are not qualified to be first line defense or healthcare, and this has really just not been proven by research about physical therapists. Physical therapists are movement specialists that have obtained their doctorate, and they are well versed in the world of musculoskeletal conditions and how to treat and diagnose them. Also, a recent research came out about the abilities of physical therapists to treat musculoskeletal conditions, and they found that out of any other healthcare provider, with the exception of orthopedic specialists, physical therapists know more about the treating, diagnosing, and evaluation of musculoskeletal conditions. So, my research question. I decided to introduce another potential barrier to direct access, and that would be public knowledge or lack thereof. I think that there's a correlation between people's lack of knowledge and misconceptions around physical therapy and whether or not your state has restricted access. So I completed a survey, I sent it out to 33 people, I received 64 responses back, and the only requirements to participate in the survey were that you were 18 years or older and you had a work email. So my survey questions. I have 5 sections within my survey. First section were demographics. These are things like age or experience with physical therapy and where you live or census. The second section were the scope of practice of physical therapy. So this is basically what can a physical therapist do and how can they do it. The third section focused on the educational requirements of physical therapists. The fourth section focused on the various physical therapy settings, and then the fifth section focused on direct access as a term, and then the laws associated with it in Texas. So the participant demographics, over half of the participants were in the age range of 18 to 25, while the smallest demographic of age were the 55 and older population, with only 6%. And then a third of the participants had received some physical therapy services in their lifetime, and 6% of the participants had been within the healthcare system in some way. So the results, I'm just going to go through each question. First question, physical therapists can. This is just how do physical therapists interact with their patients and what are they allowed to do. For this question, participants showed a lot of knowledge for it, and the majority of them answered all the questions correctly, with the exception of knowledge about whether or not physical therapists could treat without a referral, so direct access. For question 2, PTs can treat using. This is focusing on modalities, so dry needling, ice, heat, use of exercise, manual therapy, things like that. The participants did all right on this one, but about 60% of the responses didn't know things like dry needling, laser therapy, electrotherapeutics, ultrasound, and other important modalities that are used on a daily basis. Physical therapists can treat which conditions? This section, not so great. There are a lot of conditions that people are just unaware that physical therapists can treat because a lot of the assumptions are that they have to be musculoskeletal disorders and that's it. But really, diabetes, Alzheimer's, IBS, multiple sclerosis, and wound care is also a really big part of physical therapy. So, question 4, PTs need what kind of education? Over 56% of the responses thought that a PT needed either a bachelor's degree or a master's degree, which is not the case. And then for question 5, PTs can work in one settings. This also got a really good reception, and most of the participants knew the answers to these questions, with the exception of wound care and physical therapy and cardiopulmonary physical therapy. So for question 6, familiarity with direct access. This is, what do you know about the word direct access? 80% of the respondents did not know what this word meant, or term, I guess. And then 26% of the 80% they'd seen the word before, but they didn't know what it meant. For question 7, how long can PTs treat without a referral? 86% of the responses did not know the answer to this question. 26% indicated they didn't know the question, and over 14% actually knew the answer, as did this was consecutive count. So what does this mean? The positive findings are that people know in general what physical therapy is in the very traditional setting. So manual therapy, musculoskeletal conditions, treating up muscle strain, ACL tear, things like that. They also know that there are a variety of settings PTs can can work in and which ones there are. But what can we improve? Knowledge of the treatment modalities used. I think that people know a lot about their bodies, and so if you know what works for you, that's something that you know PT works with. So dry needling, if you know that works for you, maybe that's something that you reach out to about your physical therapist, and you can see if that'll be a good fit for you in your treatment. Conditions that can be treated. This is incredibly important. There are a ton of people out there who have conditions that they don't even consider physical therapy for as a way to treat or manage the symptoms for. And my Nana, she has lupus. You know, that's an autoimmune disorder, and it affects her joints greatly. She did not know until I was interested in physical therapy that she could be getting a lot of help for how she just moves on a daily basis and how she feels on a daily basis. And then educational requirements of PTs. I have found that a lot of people disregard physical therapists, I think mostly because they don't have a lot of faith in their abilities to treat as an entity in and of itself. So I think that if they understood the requirements of a PT, the doctorate degree, and the knowledge base that they hold, that a lot more people would be interested in obtaining physical therapy services. As well as understanding direct access and its laws in Texas. If you don't know that you can't just walk into a physical therapist's office and receive some form of treatment or an evaluation, that might stop you, especially if you think that going to the doctor to obtain that referral could possibly get in the way of just your day if it's an inconvenience. And so, like I said earlier, it's just a way to remove an additional healthcare barrier. So, in conclusion, my study was to determine whether or not public's knowledge or lack thereof of physical therapy could possibly affect direct access laws in Texas, and I definitely think that it can. When you increase the public's knowledge of something, you are more likely to also increase their interest. But a lot of research has shown that public interest drives public policy greatly, especially in the form of lobbying. And lobbying is actually how direct access got into law, and the states that have less restrictions, they lobby for those. And so I think that increasing understanding of physical therapy and breaking down barriers and misconceptions associated with physical therapy can really, really help in the long run for getting Texas less restricted direct access laws. That's it. Good time for questions for Tori. I did such a great job.
So you mentioned your Nana has lupus. Do you know any like specific physical therapy things that she could be doing to help with lupus?
So lupus affects everyone differently. Hers is just in her joint. She gets a lot of inflammation in her joints, but she also doesn't move very much. And so if she went to a physical therapist, and it would be something as simple as giving her things to do every single day, maybe it would make her day a little better. It would affect when she is having a flare-up. It would be better for her in the long run. So she could just do, she has a lot of other things. She's older too. So it could be just, she could fit in a lot.
With direct access, does that apply to the doctor? In some cases, you can just go straight to the physical therapist.
Yeah. You can go straight to the physical therapist. If you are unrestricted, you can just go in and be treated. If you have restrictions, you have to wait a certain amount of time, then go to the doctor, get a referral, come back.
So which organization, say you wanted to raise awareness, which organization do you think would fund that marketing, let's say? Is there a Physical Therapists Association of Texas or national? What would you do?
There's both. There's the APTA, the American Physical Therapy Association. They do a lot of work with just law-related things, and you kind of have to be a member to really do a whole lot, but they are some of the reasons why a bunch of lobbyists came together and was able to get direct access to the same thing. I believe there's a Texas American Physical Therapy Association, but I don't really know how much that would go towards lobbying. I don't know as much about that one.
Wonderful job, and I had great work. I had a similar question. What kind of information has been pushed out there about his physical therapy?
Well, It's mostly, the assumption is sports. A lot of sports, a lot of people come in, they injure themselves playing sports, or you're a little bit older, you got a knee replacement, you got a hip replacement. So I think the most that I hear people discuss physical therapy would be in the context of you're an athlete, got injured, or you're a little bit older. There's a lot more in between. But I think that's, for the most part, and it's getting better. There are a lot of people trying to increase awareness for physical therapy, but I do think that it might not be reaching as much as it should.
So in your background research, did you find that there is a difference between the number of people who access physical therapy in the open access states versus those who are restricted access?
I actually didn't, but that's one of those things that's really restricted because the American Physical Therapy Association requires that you're a member for a lot of that information. And so I think I probably would have found some if I had access to it, but I haven't. Yeah, I haven't. But I would assume so. I would assume so because you still have doctors that are referring. You still have people who have surgeries who still need a referral. So I would imagine it would be better in unrestricted states.
I have one other question. So do physical therapists, so you mentioned things like dry healing, is that something that any physical therapist does, or is that something that, are there certain things that, treatments that physical therapists specialize in?
They can specialize. For instance, when I heard about dry needling, the person who did it was the only one who did it in the clinic. So it depends. In the state of Texas, you can dry needle without needing an additional certification, but in Colorado, you can't. So it depends on what people are comfortable with and where in the body you're comfortable with it. But then also other places, there are physical therapists who really like blood flow restriction, and that's their thing. So there are definitely things that I assume they learned in school that they really, really liked, and they liked the research behind it, and so they decided that they wanted to use that with us. I don't know if it's advertised though, because one in this clinic does this. Any other questions? All right, let's give her another round. Say a few words and set Tori first goal forward.
I have had the pleasure of having Tori in class and as serving as her academic advisor. So over the past few years, I've watched her grow and develop and just really blossom. Being able to help her with her honors thesis was a great experience. She knew what she wanted to do. She took feedback very well. She did really push back when she needed to, and that was good. That was something I encouraged, but she did great, and I know she is going to do wonderful, wonderful things in the next phase of her life. And I'm proud to and happy to have watched her.